All right, everyone, we're going to get started right now. We're thrilled to be here today, and we're thrilled that you took the time to join us. I know that people from across the province have taken the time to come online. We've got 56 callers and counting right now, and I know, for example, the Northern Interior Leadership Team, maybe you guys can do a big shout out in your room. I know your lines are muted, but we heard that your entire team was signing on, so thrilled to have you. I know it looks like we've got a number of situations where there's groups of people signed on today, and we're just loving that energy and excitement about what matters to you. 59 callers and we get going. So just to let you know, we do have all the lines muted. The reason we've done that is to minimize background noise. If you have any questions, please don't hesitate to pop a question in the chat box or raise your hand, and we will unmute your line. We're just really thrilled to have you join us today. The other thing I want to just make sure everyone is aware that we are recording today's session. So it's being recorded right now, and we're really thrilled to have you join us. So, and this recording will be made available along with the slides for you to be able to access after the fact. So we look forward to being able to share this with your friends and anyone who wants to learn more about what matters to you after the fact. So we're really thrilled today. So today is all about what matters to you. And, you know, the taglines are what matters to you, and ask what matters, listen to what matters, and do what matters. And we're really, really thrilled to have you on today's line. As we get started today, you know, one of the things we wanted to really look at is explore some of the experiences in the past and the history of what matters to you, what it's all about, and what we can do. So when we look at starting this work, what matters to you is really about having a conversation. So when we have the conversation about inviting healthcare providers across BC, and this is something that's actually happening across the globe, and Andrew's going to share that with you today. But really, the opportunity to connect, talk, and ask one simple question each and every day in the care and care interactions. And that question is, what matters to you? So the aim, the ultimate goal of this work is really to encourage and support those meaningful conversations between people who provide health care and the people who actually are receiving that care. So really fostering the situation where we can have a partnership in that care, and where we can ensure that care is aligned with the wants and needs of patients and their families and caregivers. And when we look at doing what matters to you, it's really about putting the patient voice at the center of care by focusing on what matters to them and ensuring that that care is aligned with what matters. So when we think about this work, you know, often people ask, well, who's invited? Who can participate in this? And we really want to emphasize that anyone is invited, that anyone is welcome to join us. And so as we move forward right now, anyone with a patient or works with patients in health, social, or community care is invited to participate in this campaign. And so we're really thrilled to have everyone on the call today and our numbers increasing. So where does it all begin? And this is the perfect segue. This work began, you know, with a conversation and a challenge that Marie Vignano from Institute for Healthcare Improvement released. And Anders Vega from Norway really started this. He started the simple goal of encouraging these meaningful conversations between patients, caregivers, and families, and their healthcare providers. So we're really thrilled today to be able to come together to discuss this and to explore it further. And probably more important, once we moved beyond Norway, we had expansion around the world with more than 30 countries participating in 2017, and that number is growing. We're really excited right now to hand it over to Anders Vega to talk, to really share his experience, his history, and his story. And we're just utterly thrilled for Anders to come today. Anders was in the Regional Institute of Public Health. It's now, I think, about 9:30 at night over there in Norway, and he's spending his evening with us to kind of share their story for what matters to you in Norway. And really, it's all about asking what matters. So I'm going to hand the ball over to you now, Anders, and we really wanted to extend a warm welcome to you to taking the time to join us today and share your story and experience.
I'd like to thank you so much for inviting me to share with you some of the Norwegian work on what matters to you. And it's all started actually June 4th in 2014. And you maybe think, well, isn't this the 6th? But we are doing this for the 5th year now. So when the 4th of June actually became a Saturday, we decided that it has to be a regular day to invite all services to be a part of this. Here you see a picture of the badges we're wearing. If you can see my T-shirt, you can see I'm wearing the T-shirt from British Columbia. And together with that, I have the new badge from Norway with the What Matters to You message. And we started this in Norway because we had this program developing pathways for elderly and long-term conditions. And when we were developing these pathways, it was actually because we have the same struggle as you have in Canada, in British Columbia, and actually in the whole world. We live longer. And the struggle we have now is, how do we live longer? Does it look like this? Or can we actually move the bow so it looks like this? The services we can provide is not the same if it starts with the first arrow or the second bow. So you see the level of care. Where does it start for people? Is it at the first alternative or the second alternative? The cost for the municipalities and for the healthcare system in Norway is huge different from the first to the second alternative. So we had this program where we actually wanted to get a mind shift in healthcare, a mind shift that could create better health and a stronger user involvement in the services. So we were inspired by Maureen Bisognani from Institute of Healthcare Improvement. She had this talk in Orlando at the National Forum, and she talked about moving from what's the matter to what matters to you. And we are trained to ask questions about what's the matter. Small details to get the right symptoms, to know the diagnosis, and then settle a treatment. And when we ask what matters to you, we get a different story. We get something that can strengthen the user's involvement in own care and in own health. So here you see what we did. We needed to lift what matters to you to a practical tool, because everyone felt it right when they heard what matters to you the first time. It felt right in the mind, and they felt it in the heart that this is the right thing to do. But what we saw was healthcare providers tend to fall back to what's the matter questions, because what matters to you is not a simple conversation. It's a conversation on the user's half of the table, and we're not suddenly not the experts anymore. We are the providers. So we actually stole from you in Canada. We stole patient-specific functioning scale, and we developed the tool we call What Matters to You scheme, where we actually measure from 0 to 10, how well do you function on what matters to you? So we ask question, and then we start measuring to see that we actually get a better score if we put on the right action. And here you see Berit in one of our municipalities. She answered to the question when she came into a short stay in an institution, I want to come home again. She had amputated one foot because of her chronic obstructive lung disease. So she wanted to get stronger on the right foot that she still had left. And she wanted to stop using artificial oxygen because that's impossible in her own flat. So first, when she was asked, how well do you function on these three issues, you see the score in the left column, 535. And then they could immediately start action on these three issues. And after 4 weeks, you see the score raised to 10, 5, 10. And that was a very important message from for home care, because they understood they had to improve on the strengthening of the right foot, so they could keep practicing on that issue. But on those two other issues, she was ready to move home to her own flat. And Berit is not the only patient in this ward that are met by What Matters to You theme. Here you see they use patient-specific functioning scale for every patient coming to this short stay. And they all, on this sheet, they all score the better level after 4 weeks. It's not always like this, but it's an important message to both providers and to the patients and the family members that we have to work and practice on our own issues, functionings. So we actually felt that we wanted to present this to some colleagues, and in Scotland they actually heard the message in November 2015 when I was invited to a conference to talk about what matters to you in Norway. And then you guys come along, and you can see what happened when we talked about what matters to you on different arenas. And it was an amazing thing, because we never saw that we were creating a global movement. We actually wanted to have this practical approach, this one day that everyone wear a badge in Norway on duty, on their call, and actually start conversations with their patients about what matters to you. So why was this such a success? I think it was because it connected to us all, both to heart and head. It's very much about the economy in healthcare in Norway. It's probably like that in Canada as well, and in British Columbia as well. So we saw that this message actually connected in a different way. And timing is everything. We all search for the change of direction to a healthcare that really can meet the needs and at the same time be able to provide services in the years to come, where it's not so many people with their hands helping and much more users in the services as well. And I think it was a success because it's not top-down. It's create your own what matters to you day. So every service, they were able to ask for buttons and ask for some information material, but then it was up to every hospital, every municipality to find out how do we want to have our what matters to you day. It's not created from the government. It's not created from us in Public Health Institute. It's created locally. And I think it's important to point out that it's part of a whole system thinking. This is a part of our approach with building pathways for elderly and long-term conditions. And last, I like to share with you what happened when my mother in January at the age of 89 actually was terminal after a fall. She was 89, she was suffering from dementia, and she actually felt that the strength wasn't there anymore. She stopped eating and she got to a ward close to where I live. And I created this, this form with what matters to my mother. And you see my hand holding her hand. And can you imagine how it felt when nurses came into her room wearing the badges saying what matters to you in Norwegian? And it was not only on their uniform, it was also in their heart and in their approach and in their action. So I really want to share with you that this is a successful work in Norway built on those articles that I shared with you here. But what matters to you is about meeting each and every patient, each and every user with a question, listening, and follow-up and action. And we also try to measure how well do you function on what matters to you. Thank you so much for listening to me.
Thank you so much, Anders, and I'm hoping the sound is a little bit better now for everyone. Catherine, I'm going to get you to just maybe make a little icon next to your face if the sound is better. Ah, it's much better. I'm delighted to hear that. Anders, thank you so much for sharing your story. And I think the incredibly powerful thing about it is that you started this initiative, and then you got to see the initiative in action, that conversation in action, and the powerful impact of that conversation, I think, is truly amazing. So what is your hopes for this over time? What are your hopes around what matters to you and what it means for patients that are partners in care?
Well, what I really hope for is that what matters to you day is not 6th of June. I hope for what matters to you becomes every day, that we actually fill our systems with this dialogue, with this way of meeting our patients and our users.
And I think that's incredible. We really, it's just amazing to hear that story and have the opportunity to hear your experience, Anders, and the vision you had, but in terms of that impact. And, you know, how do we really create the space each and every day to have those conversations in every care interaction? And that's where the power is in building those relationships. And I think your story really brings that home, not only in your work in Norway that you've done, but also the story with your mother. And we just so appreciate you sharing that with us today. We wanted to create the space right now for everyone to ask questions, and I know it's hard to do because we've had to mute all the lines, but we wanted to invite you, if you have any questions for Anders, to pop them into the chat box right now. We really want to hear from you. Do you have any thoughts, questions, inquiries from what you've heard that Anders shared with us today? I'm so sorry to everyone for the sound quality at the beginning of the call while I wait for your questions to come in. Hopefully it's much better now, and just wanted to reiterate as we wait for the questions to come in is, you know, we really do want to invite you to share your stories as we move forward right now. And in terms of the campaign itself and the work that we're doing together, we want to invite you to join us and participate. So Edwina has a comment in the chat box, and it's about a lived experience really offers a big impact for education. So hearing how it works for you and people commenting on how they really appreciate your story. Okay, so this question here. Now, Chris, I'm going to see this question from Chris right now. We'll start with it, and then we'll take from there. And Chris asks, what level of care is the What Matters to You program intended? Might be a challenge to ask those with low functioning or dementia what matters to them. Do you want to share your experience with that, Anders? And then we can certainly answer it on this end of things as well.
Yeah, I think it's all kind of levels, but it's needed to have different tools to actually meet. And you saw an example of how I did with my mom for her last 7 days in this unit. I wrote what matters to mom. I wrote that she has 7 kids. Please remind her of all our names and that we all love her very much. And she was a piano player, and I made sure that it was possible to play Grieg's piano concerts when she wanted to listen, and to be aware of if the phase changed in a good way or if the noise was bad. So all this was written from me to give the nurses possibility of using what matters to mom in the right way. So it's about finding the right approach, and of course, if you come into the emergency room with a really life-threatening bleeding, you're not prepared for the what matters to you conversation. You want healthcare to function at the best, but when you are close to getting home again, it's maybe important to get the question, what matters to you most when you now are on your way back home from hospital?
Yeah, I think those are really important points you raised. So, you know, the power of the families and caregivers and helping to answer the questions, also the different stages in the care process where we may want to ask the question as well. And so there's some really great questions coming in the chat box. I'm just going to kind of share a couple more here. Have you seen any examples, Anders, of teams that have really kept this, and I think your team has done this, but really kept this at the front of mind throughout the year? And if so, how do they do it? So how do they keep embedding it each and every day?
Well, then for us, it has been important to bring out that this started not with one day. This started with us trying to develop pathways for long-term conditions and elderly. So we put this question into this system approach. So it's in checklists, and it is in this tool that we shamelessly stole from you, from Canada. I think it's very important to try to see how does it fit into our daily routines. And then it's important to not think of this as an interview. It's not a question answer, it's a dialogue.
Yeah, and I think that's such an important piece. And I just noticed there's still more questions coming in the box. We're not going to necessarily have time to answer them all, but maybe sort of the last question as I see here, you know, is there a patient portion that trains or encourages patients to encourage staff to ask them what matters? And I'm going to sneak in an answer to that one in terms of on the BC front and some of the work we're doing. But what we know on this work is we're really encouraging people to have the conversations. We're really focusing on encouraging providers to invite patients into that partnership, but we're also welcoming patients to invite the providers into those conversations as well. So we've got a bunch of resources on our website, and I'll post a link up there again, but we've got some stickers that say, tell me what matters to you. We also have some that say, ask me what matters to you. So we can actually take it from either approach. We want to certainly welcome you to encourage your provider to open that dialogue with you, but we also want providers to actively invite the conversation. So great question, Vicki. Just in the interest of time, I'm going to move us on now. I did want to pause, though, and just, I cannot thank you enough, Anders, for starting this work, for starting the conversation around meeting patients where they're at, understanding where they're at, and really inviting the dialogue and the conversation. If it wasn't for you, we would not be here today, and we just really want to thank you for that, but also thank you for honoring us with sharing such a personal story of your mother and your own experience with what matters to you.
Thank you so much for the opportunity, and good luck with your What Matters to You Day, not only 6th June, but every day.
Absolutely, Anders. We invite you to stay on the line. I know we're going to have some more time for questions as we move on. I'm going to now move to our next speaker, who's Linda Clark. I had the pleasure of meeting Linda Clark relatively recently, but I had heard about her story long before then, the story of her father being asked the question, what matters to you? And Linda's here today to share the powerful impact of what that meant for her, the powerful impact of what it meant to really invite that conversation, encourage meaningful conversations between providers and the people they support and care for. Now, Linda is a 71-year-old mother from 2. You'll never guess that by looking at her. She looks so youthful. She has 5 grandchildren. She works part-time in a women's clothing store. She swims 4 times a week for 1 hour. It tells you a little bit about who Linda is, and she's very active in her sorority, Beta Sigma Phi. So we're really thrilled now to welcome Linda. She's going to share her story now of what matters to you. Welcome, Linda.
Thank you so much, Colleen. And thank you, Anders, for your story about your mom. I found that very touching. Good afternoon, ladies and gentlemen, and thank you all for taking the time to listen to me this afternoon. When my father was 95 last year, he had pneumonia and he was admitted to the hospital at the Royal Jubilee. And the doctors asked, what can we do for you, or what matters to you? He'd never been asked this before, and neither had I. When he was asked this, I noticed that he was much more relaxed and at ease, and he shared his concerns about going home. And also, a side note, I talked to him the other day, and he gave me his permission to say this. I asked him, how did he feel about that? And he said he didn't remember because he was on so much medication, but if he was asked it now, he would like to know what was wrong with him, what was being done, and how long he would be there. And most of all, he said it was so nice to be listened to. I thought that was quite touching too. It opens up such a friendly exchange of thoughts and dialogue in a very non-judgmental way. When you feel you're heard, your opinion makes a difference, you have hope, you feel worthwhile, and it makes you partly responsible for your own recovery. I feel that mental health is as important as physical health, perhaps more so. It also makes you part of the equation and puts you on more equal terms. I instantly felt part of my father's journey, and I feel that when you're asked that, you are talked with. instead of at. It opens a closed mind, hopefully. It changes the cold clinical part of the hospital into something more engaging and warm. And being asked what matters to you, it shows many things, I think, something like kindness, support, empathy, and respect. In summary, first, I was surprised when I saw the doctor and heard her ask this question. Secondly, I entered into the conversation. And thirdly, I just jumped right in with both feet. Fourthly, I thought it opened a floodgate of words between my father and myself and between my father and the doctor. And fifth, the fact that my dad was listened to and so was I. And the last one is that you heard me and you responded. I don't think we need a reason to ask the question, what matters to you? I did write a little poem that I can read to you. It's called What Matters to Me. What matters to me? Well, now, let me see. Now that I've been asked, the answers, they are vast. If it can be said, I am more than a bed just behind the door in room 404. What is wrong with me? Is it my hip or is it my knee? What is being done? Will I walk or will I run? When will I go home, live my life and roam? Can I keep my house or have to rely on my spouse? And now I'm listened to. That ranks so high in my view. Empathy for me just sets my spirits free. Now that I am heard, my thoughts and my word, I no longer have a qualm now that I'm feeling calm. In conclusion, today, earlier on, I read through the Conversation That Matters booklet, and I was very impressed by the tree art installment that was made at the Saanich Hospital. I felt that it put a lovely visual to the question, what matters to you? I also came away with a new thought. Why don't I just start using the question, what matters to you, in my day-to-day life with my own family and friends, as everyone likes their voice heard? It was my pleasure joining you all today on such a compelling subject. Thank you so much.
Well, thank you so much, Linda. I think we're just so honored and tickled that we had the opportunity for you to join us, and I've so enjoyed having the opportunity to spend some time with you over the last few weeks. And I think, you know, you talked about in your presentation and about being talked with rather than at, and I think that's such a powerful comment. And maybe as we welcome people again to share their questions in the chat box. If you have any questions for Linda and her experience, her father's experience with what matters to you, we please welcome you to pop those questions in the chat box now. But the question I have for you is when you're talked with rather than at, Linda, when you're a partner in this conversation, how does that change things for you? You know, you mentioned about responsibility and care, but what does that feel like in terms of your experience and your father's? Anything you'd like to add?
Yeah, I think that other than making you responsible for your own recovery, it just makes you feel part of the hospital, your own recovery, the doctor, and your family enters into it too, because then you're talking to them about the subject. I think it just opens up a lot of things.
Absolutely. I think you're absolutely right. I just wanted to share with you, Linda, I'm not sure if you've seen the chat box. There's been a million comments and feedback on your amazing poem and your story itself. The latest one was talking about so wise and human. And I think it is that just behind the door in room 404, you know, that we're more than a bed and more than a patient. We are people. And so the power in remembering that, I think, is something that you really shared. So, you know, on the line right now, I know we talk about what matters to you, and we really want to encourage the question being asked each and every day in every care environment. You know, what is a key tip or a suggestion you would give to anyone in the system right now about what they could do differently, what they could do to help, you know, why would you want them to embed this question into the work they do each and every day?
Well, I think that it shows respect. And when you have respect, you have more cooperation. When you have cooperation, the healing goes quicker.
Yeah. Yeah, and so true, absolutely. That partnership is really powerful, Linda. We've got a question that's come into the chat box here, and this is from Teresa. And Teresa asks, what do you think of the different mediums or the different ways of asking the question? So she said, for example, a conversation versus a written note or an intake form. Are there things that need to be done to create the space for that conversation, or different ways you can kind of support the conversation?
Oh, absolutely. I think that all of those ways are good. I happen to be a talker, so the verbal word is better for me. But then a lot of people, I'm also visual, so written is good as well. I think that you have to maybe feel the person out and see which would work best in that situation. There may be some cases that one way would work better than another.
Mm-hmm. And I think that's one thing we've talked about a lot. For many of you out there may have a question, but I work in a different kind of setting and I'm not sure how the question would work, or I work in a different environment and I'm not sure how I would embed it. And one thing we're going to talk about next month is a little more around how do we create the space. So how do we ask this question in different environments, in different ways? How can we even ask the question in different ways that might work better for the clientele you're working with, the people you're talking with? And I think the other thing that you raised that's really important is that the method that you use to have the conversation is really around aligning it with what the needs of that individual human being is, and learning who they are to best understand how you can best foster that conversation, I think is what I heard you say, Linda.
Yeah, absolutely.
Mm-hmm. Yeah. I love some comments that are showing up in the chat box right now. Brett just put a comment in there and he said, one of the things our public health nurses do on Vancouver Island is ask when working with prenatal women is, what are the hopes and dreams for your pregnancy? And I think that's such a really nice way of shifting the question and really looking at ways we can invite people into that partnership and conversation about care. So thank you for sharing that example, Brett. We've got another question that's asking about how are we going to capture the results of asking what matters to you, the metrics and the impact. And that's a great question, Tracy. It's interesting, how do we create the space to really understand what this is shifting? And so a lot of this, and if you look at our evaluation report that's online that we did last year, has been really focusing on the story at the early stages right now, focusing on the story and what we're seeing as shift. I think we also focus on some of the quantitative data in terms of the spread where we were seeing participation around the province, and that was another big piece of that. So looking at the impact both in terms of the story, and so we really welcome you as you head off to invite people into these conversations, for all of you to come back and share your stories. There is an area on the web page where you can share your stories. Catherine, I'll maybe get you to pop that link into the chat box so people can see that. But we really think it's important to hear those stories, to learn more about the impact of this work. It's a big cultural shift and about really inviting patients and their families and caregivers into those conversations. I'm not seeing any new questions popping in the chat box right now, Linda, so I just wanted to pause right now before we move on to Lillian to thank you. Your willingness to chat with us and highlight what it was like to be on the receiving end as a family caregiver for your father. When the question was asked and the impact it had, I think it's really powerful to hear this and to hear what the experience is like for those who are receiving care or supporting those receiving care. So thank you so much for taking the time to join us today, for sharing with us your incredible poem and the story itself.
Oh, thank you, Colleen.
Mm-hmm. Just before I move on to thank you again, to introduce Lillian Hung. I did want to just answer the one more question that's come into the box, and I think it was from Edwina, saying that sometimes that it can be a challenge to think that there's not time for the conversation. And it's interesting, I'm glad you raised that question because I think it's a very important one, and we can share some literature, maybe we can find a place on the site, we can put this out or send it out to the group after today's call, is that we do know that taking the time to have the conversations by ensuring that care is aligned with what patients and families' priorities are, we actually know that care is more efficient in the end. And so it can seem counterintuitive to take the time to have the conversation, but we actually know that care is more likely to be aligned, more appropriate in terms of what the patient wants, and that on average, the amount of time it takes isn't significant. Now, again, in that Conversations That Matter resource, we're going to actually, Stephanie, one of our colleagues, is going to kindly delve into that very question. So we look forward to sharing that with you, but definitely a great point. But what we found actually in action, and from those people who really have started to embed this question into their practice each and every day, they're finding that it takes less time. It really creates a space for more appropriate care and helps ensure that it's really aligned with patients and their families' wants. All right, I'm going to move us along now. We've had our questions, and I just really wanted to, it's a pleasure now to introduce Lillian Hung. So Lillian is a clinical nurse specialist with Vancouver Coastal Health. Specifically, she works with an older adult tertiary mental health area, and her research area is on person-centered care for people with dementia. And I think we couldn't think of a better alignment in terms of some of the work around person-centered care and really working with its population and talking with both people with dementia and their families to support them in their care. Now, Lillian was a passionate advocate for What Matters to You the first time around. The first time around, we focused on a single day of action. This time, we're really trying to focus on embedding it into practice each and every day. So rather than a single day, June 6th is going to be a day of celebration, a day of reminder of why we want to do this. I think I should focus on that latter, the day of reminder. But really, it's about a conversation that's every single day. And so Lillian is going to share her story of what it was like to have that conversation every single day. Welcome, Lillian. Thank you so much for joining us. And thank you so much, Linda.
You're welcome.
Hi, everyone. Can you hear me okay?
It's great.
Hi. Okay, great. Thanks, Colleen. I appreciate the opportunity to be here, to hear the powerful stories from Anders and Linda. Linda, your poem is so beautiful. As a clinical nurse specialist, my work in Vancouver General Hospital is mainly involved in practice development. It's about bringing the best practice and innovations to enhance patient care. I serve mainly the older populations. Many of these people have cognitive impairment and dementia. Person-centered care is the philosophy, something that we want to achieve. In order to be person-centered care, we know that we need to know what matters to our patients, our families, and the team. So the work of What Matters to You is really vital and relevant to us. Just a bit of background on how we began our journey in the What Matters to You work. Last year on June 6th, BC Patient Safety Quality Council launched the What Matters to You campaign. The VGH staff, multiple medicine units, we joined their celebration. It's just such a great way to engage our clinical staff to talk about what matters. So you can see in the next line with all these photos, we invited everyone to come to our randomized control coffee trial. Oh, forward, yeah. Next one. This one, yes. So in our randomized coffee trial, people come over, have coffee on the unit, and we turn the staff room into a coffee room. People talked about what matters. So we decorated a selfie station. People had lots of fun. We ate What Matters to You chocolate cake. That was delicious. And next line that you can see on that day, the staff, the leaders, they came to the unit, they had coffee, they also doodle about what matters to them. So that was also a great way to have conversations. People like paint, color, and write down what matters. And we had a really high turnout. Physicians, many nurses, director, managers, housekeeping, unit clerks, OT, PT, many people came and they participated in the conversation. So we reflect on that day what people talk about. The most common theme is really teamwork. Many people talk about teamwork really matters to them. People want to have good relationship with their teammates in order to provide the best possible care for our patients. I also went to patients and families. I went around and I asked what matters to them. I heard about how stressful and difficult for them to be in the hospital. Some of the conversation was quite emotional. To me, the common theme that really stand out was the emotional support was hugely important. Patients and families, they appreciate staff spending time to listen to what matters to them. This particular patient, he told me that it isn't, he told me that it's really important to find joy in life, even when you're in the most difficult situations. He was in very difficult situations because he was having a lot of pain. And he said, it doesn't matter that you're a patient, a nurse, or a doctor, finding joy gives meaning in life. I thought to myself, what he said is really right, you know. That's a great wisdom in there that for me to learn. Working in the hospital, it's so easy to focus on what matters with the patient. It's kind of a little bit like what Anders said, that, you know, we are good as clinicians. We are trained to treat symptoms and disease, fix what's wrong. So we often tend to go into details to try to find out what matters with the patients, what might be some of the symptoms, what's wrong, you know. It's so easy to forget about what matters to the patient, what actually is very important to the person. So now let's talk a little bit how to. How do we embed these conversations asking what matters to you in our everyday practice? To embed something new into practice, it's about making a culture shift, just like what Colleen talked about. The thing is, I think there's no single person can change a culture. Culture is really a shared thing when you think about it. I cannot change a hospital culture to make it person-centered care. I can't do it by myself. As a change agent, what I can do is to have new conversations with people. What I do is I bring people together to have conversations. We talk about what matters, what's important, what does the person, the patient, the residents, or the client need. In my work, I use the Pieces language, which is a best practice program developed in Canada. In our team conversations, we ask, what do the patients need? What may be the unmet needs? Instead of assuming, you know, a person with dementia that the person is just aggressive. Pieces provides a positive approach to help us to reframe those conversations. You see, when we have these new conversations, if we say it again and again, when it happens over and over again, it becomes our habit. When we have more and more people talking this way, it becomes a new discourse. Then we have the new culture. So having the culture shift in order to change a culture or having a transformation, I think it all begins with having these small conversations. Here, I propose the ABC of making it, the new conversation, asking and doing what matters to you. How do we make it happen every day? So I put it into the ABC. A, it's about appreciate. Appreciate the power of asking what matters. B, it's about building a routine. Build a new conversation into your team, your clinical routine, whatever practice routine that you have. For us, it's about safety huddle, Pieces huddle, or for some people, it might be bedside rounds or other routines that you have in your clinical setting. C, it's about continuous development. When we plant a seed, we want to have a new growth, a new culture developed. It needs support and nourishment. So we need to nourish those team efforts when we get people kind of say, oh, this is the right thing to do. But the hospital, the organization also need to provide the support to make the continuous improvement happen. So how do we do it in Vancouver General Hospital? In our older adult mental health unit in Willow, we do huddles. I mentioned about huddles. So we do safety huddle twice a day, one in the morning, one in the afternoon. We do Pieces huddle once a week on Fridays. By having this routine, it makes the team conversation happen. In the Pieces huddle, we also include family in our conversations because family is a part of the team. Pieces is the best practice approach, like what I have mentioned in the care of older adults. It offers a framework with 3 simple question templates for team conversations. So we ask what has changed with the person, what may be some of the possible causes or unmet needs, what action we need to take. I like the Pieces approach because it helps you to think about what matters to the person, what's important, what's meaningful to the person. It also takes us to the action, so it's not just about the topics. The third question is about what's the actions, right? So it has opened up many possibilities for us. We've been practicing Pieces since 2014. It's 4 years now. Our goal is really to embed, the Pieces into our, not just the team huddle, but also everyday thinking in our everyday practice. So that means, every team member will be mindful about thinking about what matters to the person, and asking about it and also doing something about it too. So overcome the challenges. We all know today's healthcare is fast-paced and all the clinicians are working more with less. Some people may be fearful about not having the time and resources to deal with more problems. Asking what matters to you may seem like a nice thing to do. Some people may think it's not possible. People may assume, the older patients, those really frail with cognitive impairment or dementia are confused. They might not be able to tell you. So it might not be worthwhile and waste of time to ask them that question. But in my PhD research, I went and asked patients with dementia about what's important in their care experiences. They not only have a lot to say, they offer very useful insights that actually can support our practice development. They talk about what it means to have color on the wall, what they need for their health and their healing. So my advice is really not to assume patients who may be old or frail cannot tell you what matters. You may be surprised when you go start to ask that question. Some people may be nervous about asking what matter that, they worry about they can't fix those problems, if the problem is really big, And I think we all can relate to times that when we are sick, we're scared, and, when we are being that patient role, that we want someone to listen, to understand what's going on with us, Most importantly, really to know, the care providers, they care about us. It's really, this is humanity. A human being caring about another human being, right? The full presence to be there for the person is a great gift in those moments, I think. So lastly, I think asking what matters to you is something we all can do every day. Simply being there, when we choose to be fully present, to listen and to learn from our patients, do our best to try to understand what's important to that person. We are taking the first and the most important step of providing good care. I like this quote because sometimes when we need someone to be there, let us feel that we are cared for and we are supported. Like in the hospital, when we have, the patients, may have dementia, or we may not be able to fix or take away that dementia, but we can always be there to support the person with good care. So thank you for taking the time listening to me and the work that I do in EGH. I look forward to questions and conversation.
Oh, wonderful, Lillian. Thank you so much for joining us. I think when we talk about this, we've heard the perspective today of Anders sharing where this all started. From Linda and hearing the impact on the receiving end of being asked the question, and for you hearing about, how have you done this? How have you encouraged and supported these meaningful conversations, and how you've embedded into practice each and every day is so powerful. And I think one of the things you said that I think is really important is that, don't assume that somebody can't answer what's important to them. And I think that they can tell you, and what are ways you can even watch for those answers even by observing them in their day-to-day practice. Lots of comments coming into the chat box as well. I really like the examples of tangible things that we can do, and love the ABCs. So we're going to welcome people right now again to invite you to ask any questions in the chat box that you may have for Lillian. Lillian, it's just brilliant to hear you share the story of how you've done it. Now, I guess the question I have for you right now is, so when we look at the population you work with the team that you work with, what do you think the tip was for you that engaged your team to start these conversations with the people they support and care for? What inspired them to be so willing to do this each and every day and embed it into their practice?
Oh, I will echo what Andrew said. This connects people's heart. It's naturally when when we talk about, I don't have to convince them. It makes total sense, like, when we talk about person-centered care. Care providers come in, they want to provide good care. In order to provide good care, you need to know what's important to the person, right? I don't think we have to do a lot to convince people why we have to do this, but I think it's about, the B part, building a routine and finding ways to remind people to do that. I think that's the most tricky part, I think, yeah.
Mm-hmm. Yeah, that's a brilliant answer, and thanks for sharing that. And I think ways to remind people, I'm going to do a shameless self-promotion plug again, and I'll get you, if you don't mind, Catherine or Stephanie, popping the link into the chat box of where people can order resources. I think right now what we're looking at is the opportunity to order these resources and have stickers, buttons, posters, things that you can leverage that are freely available for you to use to help be that reminder to have those conversations. I think you've raised a really important there, Lillian. The other thing is there was one question. A lot of people aren't necessarily familiar with the PIECES tool, and I wanted to make sure I honored that question. And what they asked about is PIECES a tool that can actually also be used with children and youth? And so there was just a question around what PIECES exactly was and the different contexts in which it can be used. So I wanted to just create a space for you to answer that as well.
Okay, yeah. PIECES was first developed for use in the older adult populations. It's mostly for people with complex, a lot of it, they have like behavior challenges like dementia, but it has evolved over the years. And people have used PIECES in our tertiary mental health demonstration project. I think some of the folks over there have used PIECES with the younger populations as well. So we have now looking at actually the PIECES Canada and a team of people are looking at reviewing, the visions and the purpose and update the PIECES curriculum and looking at PIECES actually can be applicable with the whole population, people with mostly with complex complex conditions. A lot of these folks often have like multiple conditions. Yeah.
Great. Thank you so much for answering that, Lillian, and thank you very much for sharing your experience and your story. We're thrilled that you could join us, and I just wanted to take the opportunity to thank you so much, Lillian, for joining us and for your passion and commitment to this work. Also, before we hand it over to Stephanie to kind of share some things on how to move this to action with everyone, I wanted to just reiterate our thanks to Linda and Anders as well. So thank you, Lillian, Anders, and Linda for joining us today and sharing each of your really unique perspectives on this work. I know there were sound quality issues at the very beginning of the call today, and our apologies again for that, but I just want to reiterate a few things before we hand it back to Stephanie. And that really is, it's about what matters to you is about inviting the providers across the province to embed this question in their practice each and every day in order to encourage those really meaningful conversations. And it's about putting the patients and their family members right at the center by focusing on ensuring that care is aligned with what matters to them. And in terms of inviting people to participate, we're inviting anyone in the province to participate in this work. If you're a passionate patient and you want to chat this up, there's an incredible engagement opportunity on the website right now. If you want to maybe put a link, if it's still open, Teresa, into the chat box, that would be brilliant. If you're a provider and you want to learn more, we really encourage you to open up the dialogue and have these conversations about matters, and they are about dialogue, that interaction. As I mentioned, there's an abundance of resources, and Sabrina has kindly put a link to the order and download resources page where there's resources we've made available for you for free of charge that we will ship to your door to make it really easy to participate. Last year, we lit up the province. Literally, we colored in the entire province in terms of shipping over 60,000 resources across the province for people to participate, and we really want to invite people to do that again. So thank you again, everyone, for joining us. We're thrilled. I'm going to hand it now over to Stephanie to kind of share some of those resources that matter and where we can go next.
Hello, everyone. So maybe you've heard, and if not, we are very excited to share that we have a new website. So it was launched last week, and that means that the What Matters to You web pages are even easier to navigate. I also want to share that there's already, as you can probably feel it on this conversation, a buzz across BC. We've been hearing from providers across the province ready to order resources and create their own. In Northern Health, one provider is ready to order 40 t-shirts. In Vancouver Coastal, another provider wants to order enough resources for 5 units in all the administrative areas, which is fabulous. And in Fraser Health, a frontline staff member actually has recently come up with their own idea to create silicone bracelets with what matters to you on them for staff as a reminder. And I'm going to quote from their email. They said, every person that is here has an important role, and without everyone in their role, we wouldn't have the excellence of care that we strive for. So I just found that a super creative way to remind ourselves to ask what matters to you. And I definitely think it's this kind of energy that will keep the movement of asking what matters to you going each and every day. So here we have some tools that we've been chatting about for What Matters, and these were created with feedback from providers and patient partners to make it easier for everyone to participate in what matters to you. And they can be ordered or downloaded. And so the list is there. There's anything from posters to lanyards to bookmarks. One really neat part is that the buttons and stickers, there are some created for patients, and then there are some created for partners, and you can see them there as well. In addition to these resources, we also have created a bingo card. So we kind of saw it as a fun way, and we're looking forward to hearing from you as well to engage colleagues in fostering patient and family-centered care. And as a bonus, because we do like to keep things fun, you can win prizes. And I actually, during this webinar, had someone email me asking about T-shirts. So we do have T-shirts available that you can order, and we will ship them to you. And if the first 20 people who email us a completed row do get a What Matters to You T-shirt, and the first 5 people to complete a full bingo card will actually win 5 T-shirts to use however they want in their organization. So please do send us an email with that. We also have a Getting Started Tips resource, and this can be used whenever you decide to start, or even if you've already started. There are different parts that you can pull out there, and it is ready for you year-round because What Matters to You in BC is an ongoing initiative. We also have a Head of Bed resource, which was inspired thanks to Fraser Health. And then we also have PowerPoint templates and a PowerPoint presentation ready to go in case you're going to any meetings in the near future and throughout the year. There is also a newsletter template, so if you're leading the way in communications for your unit or health authority, please feel free to download and adapt that as you will. Or if you're someone who runs your own newsletter, please feel free to use that. So since we're in this all together, it's great to learn together as well. And so we want to hear about whatever you are comfortable sharing, and perhaps that's how you and where you were asked about what matters to you. Maybe being asked what matters to you greatly improved your care. We want to know why and how that happened. Maybe you have a stronger relationship with a provider or patient because of a What Matters to You conversation. We want to know about the difference that is made. So there is an easy online template that we've chatted about and that there's also a link to as well, where we'd love to encourage you to share whatever you can, because we will anonymize that, but share that back if you do feel comfortable over the coming while to make sure that we're all learning together. We also want to hear from you throughout the year, and so our fabulous communications team, being the fun folks that they are, will have some friendly competitions or engagement on Instagram, Twitter, and other social media platforms. So perhaps you showed up wearing a What Matters to You t-shirt on the same day as your colleague. Feel free to grab a picture and share it with us using the hashtag What Matters to You, and you can see that hashtag in the bottom right corner of this slide. Maybe someone asked what matters to you in an interesting place. Perhaps it was in front of a tree art piece in the hallway. We'd love to see where these conversations are happening, and so would everyone else, again, to kind of stretch our imagination about where and how we can ask that question. So we definitely don't want to leave you hanging after this webinar, and wanted to let you know that upcoming on May 9th, so just under a month from now, Professor Darren Hicks has kindly offered to join us and share his knowledge on collaboration and networks. We will also be showing our first ever for What Matters to You skills-focused video that you will be able to share at meetings and through your different communication channels. I do want to say a big thank you to all those on the call who participated in this project. It takes a lot of organization and encouragement to get people to have those mini interviews. At this webinar, we will also release a new resource filled with tools for providers and patients called Conversations That Matter, and we definitely look forward to hearing your feedback on that as well. And then for June 6th, we have some exciting ideas to get engaged and remind ourselves of the great work we have been doing, as well as how we plan to ask what matters to you each and every day. So seeing that I want to keep everyone on time, and we're already at 1:30, we're going to skip through these questions. But again, our email address is on the webpage for What Matters to You. Please do email us. We would love to hear from you and continue to support you with any questions you have. So I just want to finish off by saying how grateful we are to Anders, Linda, and Lillian for sharing their inspiring stories and experiences with all of us. As well to everyone for joining us today, thank you for making the time. We know you'll be the ones to continue sparking the What Matters to You conversations, and we look forward to supporting you and staying in touch all year. Since this is an ongoing initiative, your feedback is very important and valuable. So if you can take 5 minutes for the survey that's going to pop up as soon as you sign out of the webinar, we would love that. It helps us integrate that feedback right as we're moving along. Much appreciated. So please check out our web pages. Let us know if you have questions. Please feel free to order. And we want to wish everyone a great afternoon.
Indeed. Thank you so much, Stephanie, and thanks so much to everyone for taking the time to join us today. We are utterly thrilled that we're moving forward with this work again, and think it really puts fostering patient and family-centered care at the center of care by having these conversations that matter. So we welcome you to join us, and we challenge you to spread the word around the province, and we look forward to joining you again in May. Have a wonderful day, everyone, and thank you so much.